Tuberculosis. The very word evokes a chill, a whisper of mortality that has haunted humankind for millennia. It is a disease as old as civilization itself, a testament to our enduring struggle against microscopic enemies. But what exactly is tuberculosis? At its core, tuberculosis is a chronic infectious disease. It is primarily a disease of the lungs, although it can spread to other organs. This insidious invader sets up shop within the delicate tissues of the respiratory system, wreaking havoc on its unsuspecting host. The disease is caused by a bacterium known as Mycobacterium tuberculosis. This tiny organism, invisible to the naked eye, is a master of disguise and persistence. It can lie dormant within the body for years, only to re-emerge with a vengeance when the host's defenses are weakened. Tuberculosis is a formidable opponent, but it is not invincible. Armed with knowledge and vigilance, we can combat this ancient foe and strive for a world free from its grip. Tuberculosis is not a recent enemy. It has been a persistent and deadly adversary for humanity for millennia. Its presence has been etched into the annals of human history for centuries, leaving a trail of suffering and death in its wake. The disease has left its mark on ancient texts and skeletal remains, providing evidence of its long-standing impact on human populations. The disease has been found in Egyptian mummies dating back to 3000 BC, a stark reminder of its long reign over human health. These mummified remains show signs of spinal tuberculosis known as Pott's disease, highlighting the ancient struggle against this relentless foe. Ancient Greek writings describe a wasting disease they called phthisis, characterized by cough, fever, and emaciation. These descriptions bear a striking resemblance to the tuberculosis we know today, showing how little the disease has changed over the centuries. The Greeks' detailed accounts of the symptoms and progression of the disease provide valuable insights into its historical impact. Roman physicians also grappled with the disease, recognizing its contagious nature and attempting various treatments to combat it. Throughout the Middle Ages, tuberculosis continued its relentless march, decimating populations across Europe and earning a fearsome reputation. It was during this period that the disease earned the chilling moniker consumption, a testament to its ability to consume its victims from the inside out. The term consumption vividly described the wasting away of the body as the disease ravaged the lungs and other organs. The 19th century saw the rise of crowded urban centres, providing fertile ground for tuberculosis to spread rapidly among the population. The disease reached epidemic proportions, becoming a leading cause of death and a major public health crisis. Tuberculosis claimed countless lives, with death records from the era showing its devastating toll on society. It was not until the late 19th century that the causative agent of tuberculosis, Mycobacterium tuberculosis, was finally identified by Robert Koch. This groundbreaking discovery paved the way for the development of diagnostic tests and eventually effective treatments, marking a turning point in the fight against tuberculosis. Tuberculosis remains a formidable global health challenge. The World Health Organization estimates that 1/4 of the world's population harbors a latent tuberculosis infection. This means that these individuals carry the bacteria but do not show symptoms and are not contagious. However, they remain at risk of developing active tuberculosis later in life, especially if their immune system weakens. Each year, millions of people develop active TB and millions die from this preventable and curable disease. Tuberculosis thrives in poverty-stricken regions where overcrowded conditions and limited access to healthcare fuel its spread. It disproportionately affects people living in low and middle-income countries, highlighting the stark health inequities that persist globally. The primary culprit behind this global scourge is Mycobacterium tuberculosis. This slow-growing bacterium is notoriously resilient, able to survive for long periods in the environment. It spreads through the air, primarily through tiny droplets released when an infected person coughs or sneezes. These airborne particles can linger in the air for hours, posing a silent threat to unsuspecting individuals. Section 4. Invasion from within, the pathophysiology of tuberculosis. The saga of tuberculosis begins with a single breath, a seemingly innocuous act that can set off a chain of events leading to a serious infection. When a person inhales air contaminated with Mycobacterium tuberculosis, the bacteria journey deep into the lungs, reaching the alveoli, the tiny air sacs where oxygen exchange occurs. These microscopic invaders are now in the perfect environment to begin their assault. Here, the real battle begins, a battle that will determine whether the infection takes hold or is swiftly neutralized. The bacteria are met by the body's first line of defense, macrophages, specialized immune cells that engulf and destroy foreign invaders. These cells patrol the lungs, always on the lookout for potential threats. In most cases, these macrophages succeed in containing the infection, preventing the bacteria from spreading further. They act quickly and efficiently, neutralizing the threat before it can cause significant harm. However, Mycobacterium tuberculosis is a cunning adversary, one that has evolved over millennia to survive and thrive within the human body. It has evolved sophisticated mechanisms to evade the immune system, hiding within the very cells meant to destroy it. This allows the bacteria to persist and multiply, even in the face of a robust immune response. The bacteria release substances that prevent the macrophages from killing them, effectively creating a safe haven within these immune cells. This subterfuge allows the bacteria to survive and even thrive within the hostile environment of the human body. Over time, the infected macrophages form clusters known as granulomas. These structures are the body's attempt to contain the infection, walling off the bacteria to prevent their spread. These granulomas are the body's attempt to wall off the infection, preventing its spread. They act as a physical barrier, trapping the bacteria within a confined space. However, the bacteria can persist within these granulomas for years, lying dormant but still alive. This dormancy can last for a lifetime, with the bacteria waiting for an opportunity to reactivate. In some cases, the body's immune system weakens, either due to factors like malnutrition, HIV infection, or aging. This weakening of the immune system provides an opportunity for the bacteria to break free. This provides an opportunity for the dormant bacteria to reactivate, breaking free from their granulomatous prisons and multiplying rapidly. The reactivation of these bacteria can lead to a full-blown infection, causing significant damage to the lungs and other organs. Section 5. The landscape of disease pathology of tuberculosis. Tuberculosis, often abbreviated as TB, is a complex and multifaceted disease that primarily affects the lungs, but can also impact other parts of the body. Tuberculosis leaves its mark on the lungs, creating a distinctive pathology that can be observed both macroscopically and microscopically. The damage it causes is both extensive and unique, making it identifiable through various medical imaging techniques. The initial site of infection, usually in the upper lobes of the lungs, develops characteristic lesions known as gonfoci. These lesions are the first indicators of the body's response to the invading bacteria. These gonfoci are small, greyish-white nodules, representing areas of inflammation and consolidation. They are the result of the immune system's attempt to contain the infection. As the disease progresses, these lesions can expand, forming larger areas of consolidation and cavitation. This progression signifies the worsening of the infection and the increasing difficulty in treating it. Cavitation, the formation of cavities within the lung tissue, is a hallmark of tuberculosis. These cavities are filled with infectious material and can further spread the bacteria when the patient coughs. Microscopically, tuberculosis is characterized by the presence of granulomas. These granulomas are the body's way of trying to wall off the infection and prevent it from spreading. These granulomas consist of a central core of caseous necrosis, a cheese-like material composed of dead cells and debris. This necrosis is a sign of the tissue destruction caused by the bacteria. Surrounding this necrotic core is a ring of macrophages, lymphocytes and giant cells, reflecting the body's ongoing immune response. This cellular arrangement is crucial for understanding the pathology of TB. Tuberculosis can spread beyond the lungs, affecting other organs such as the lymph nodes, bones, kidneys and brain. This extrapulmonary spread can complicate the disease and make it more challenging to treat. This disseminated form of tuberculosis, known as miliary tuberculosis, is particularly dangerous and can be fatal if left untreated. It represents a severe form of the disease where the bacteria have spread widely throughout the body, causing numerous small lesions in multiple organs. Section 6. Recognizing the enemy, symptoms and signs of TB. Tuberculosis is a master of disguise, often lurking silently within the body for weeks, months, or even years before announcing its presence. When symptoms do appear, they can be subtle and easily mistaken for other respiratory illnesses. The most common symptom of tuberculosis is a persistent cough. This cough may start dry but can progress to produce phlegm, sometimes tinged with blood. Other respiratory symptoms include chest pain, shortness of breath, and wheezing. Beyond the lungs, tuberculosis can manifest with a range of constitutional symptoms such as fever, chills, night sweats, fatigue, loss of appetite, and unexplained weight loss. These symptoms reflect the body's ongoing battle against the infection. The signs of tuberculosis can be equally subtle. Physical examination may reveal crackles or wheezing in the lungs. Lymph nodes in the neck or other areas may be enlarged. In advanced cases, patients may exhibit signs of wasting, such as muscle wasting and loss of body fat.